If you're having a stroke, time is of the essence. Now, a study just released by Kaiser shows a new program in their hospitals is cutting that time to get treatment nearly in half. ABC 7 News reporter Jonathan Bloom has more on what they found and who can benefit.
I was watching TV, watching the 49er game, which is enough to give anybody a stroke.
Bob Wilms hasn't lost his sense of humor, but he almost lost so much.
I kind of dozed off in my easy chair, my recliner, and when I woke up, everything was double.
Bob knew he was having a stroke.
I started feeling a little bit of numbness in my face.
He called for his wife, who drove him to the hospital.
They immediately came with me to the car, got him in a wheelchair.
Surrounded by hospital staff, he came face to face with Dr. Kevin Sawchuk.
It was very clear that this was a stroke in the brainstem where all of the nerves are really packed tightly together.
He made the diagnosis from miles away using the wireless stroke cart that's now in every Kaiser emergency room in Northern California.
The camera is extremely powerful, and so from the foot of the bed, I can actually focus in on one eye if necessary.
It's part of a Kaiser program called Stroke Express.
It allows us to bring the specialist immediately to the bedside as the patient arrives.
The Stroke Express process actually begins with an alert that's called in from the ambulance. And when the patient arrives, the diagnosis happens right here in the hallway.
For that particular moment, we consider that patient the sickest patient in the emergency department.
Diagnosis can take less than 5 minutes.
The next thing I knew, they were racing him up on the gurney to have a CAT scan taken.
At the same time, the pharmacy is mixing this clot-busting drug, TPA. If the scan determines it's safe, it's given right then and there.
We know that when we give TPA faster, the outcomes are better.
And a before and after study shows Stroke Express cut that time down by 20 minutes, nearly in half.
Could be the difference between somebody being able to enjoy, Christmas with their grandchildren and somebody that their grandchildren may have to go and visit them in a nursing home.
For Bob, the drug worked.
I would have gotten back in my car and gone home if they'd let me.
And while Kaiser hopes the research helps other hospitals reduce stroke treatment times, Bob's hoping these new clubs reduce his stroke count on the golf course.
I'm just learning how to use them. But it's a good thing.
In Cupertino, Jonathan Bloom, ABC 7 News.